Hi everyone, and welcome to today's webinar talking about what is geropsychology. My name is Sarah Johansson and I work in the marketing department here at the college. So I'll be your host for today's webinar. I'll give a little bit of an overview of William James College, go through a few housekeeping things, and then we will get into today's presenter. So we can move on to the next slide. So today you'll be hearing from Dr. Catherine King, who is the director of the Geropsychology concentration here at William James. She's also an assistant professor of psychology in the clinical psychology department, and she's the director of the Alliance for Aging that we have here at the college. And then you'll also be hearing from Elizabeth Beaton, who is an admissions counselor in our admissions department. And as I mentioned, my name is Sarah Johansson. So we can move on to the next slide. And before we get into the presentation today, I just want to reiterate that it is a live webinar, obviously. So we want to make sure that it's really an interactive experience that you can really get all the questions you have answered. So at any point during the webinar today, just submit your questions to the question box and we can go through those. There'll be a few opportunities at the end of the webinar to get those answered. I will also add that in the handout section, you can download all of the slides that you're seeing, so you can have that as a resource to look back on. So next slide, please. So a little bit about William James College. As you can see on the map, we are located in Newton, Massachusetts, which is just outside of Boston. You can see that we're easily accessible from a number of major highways, which is really great for our students to get to campus when they need to, and also provides a lot of opportunities in Boston and around Boston for different field placement, internship opportunities, collaborations with different organizations, and lots of great things in the area. So it really is a great location for our students. So on the next slide, here you can see an overview of all the departments we have here at the college. So as I mentioned, Dr. King is a professor in the clinical psychology department, but then we also have a counseling department, an organizational and leadership psychology department, and a school psychology department. And we have a number of different degrees at the master's level, at the doctoral level, as well as some certificates in those departments. And we also offer a bachelor's completion program in psychology and human services, which we're really excited about. We just had our first graduating class of that program this year, so that's really exciting for us. So we can move on to the next slide. And it is my pleasure now to introduce Dr. Catherine King.
All right, am I up?
All set, Kate, we can hear you, yep.
All right, fabulous, thank you. I guess you can go on to the next slide, which should be my beginning of my presentation. Ah, yes, there we go. So welcome everyone. Thank you so much for coming to the webinar today. Whenever we host an event about geropsychology and people attend, I am just thrilled and delighted. There is such a high need for individuals with the competency to serve older adults at this point, which we'll get into in a little bit. And unfortunately, there remains to really be a serious workforce shortage in this area. This isn't just in the area of clinical psychology. This is really across healthcare. It almost cuts across, all specialties, whether it's medicine, nursing, all the different medical specialties, psychology, social work, and so on. There's just not enough people who are interested in working with older adults. And there's a variety of reasons why that might be. There's some research, including some work that I've been involved in trying to figure that out. So thank you all for having some interest and for coming today. And I'd love to really help facilitate any interest you have, whether it's all the way to becoming a geropsychologist or just kind of picking up some knowledge and competency along the way as a graduate student, as more of a generalist who understands the importance of serving older adults as part of that generalist competency. So you're probably wondering about this painting. So you can move on to the next slide here, and you can see why this painting shows us what it feels like to be a geropsychologist in 2020. We are this very tiny little specialty niche facing a giant wave of retiring baby boomers and aging population for which, as I was already starting to say, we are really underprepared. Again, sort of across healthcare, but certainly within psychology. So you can move on to the next slide. Just give you a couple stats here. Let's see, wait for the next slide here to pop up. There we go. National Institute of Aging estimated a need for about 5,000 geropsychologists by this year. And unfortunately, friends, we did not achieve that goal by any stretch. Another study, you can go on to the next slide. Let's see, we should have another number show up. There we go. Another study found that there's currently only about 700 AP practitioners, psychologists working with older adults at least 50% of their time. So that doesn't mean those 700 people are all geropsychologists, but they are people who are serving older adults at least half of their clinical work. So that might be someone who's a generalist and sort of developed this skill set over the course of time, or this focus, or they might be people who do acknowledge and recognize themselves as geropsychologists. But nonetheless, it's a very small number compared to what that need is. And then we'll go down even further and talk about those people who have a very strong identity as a geropsychologist. We can go to the next slide. And that is board certified geropsychologists. There's so few. There's so few. There's, I think we might be around 70 now. The slide might be not completely up to date. But as you can see, the number of board certified geropsychologists is so small compared to even the people who generally serve older adults, and all still like shockingly less than what the need is. So again, this is why I am passionate about helping to build people's interest in this specialty area at William James in my role as the concentration director, as well as just in my role as core faculty. Again, I just want people to be thinking about serving older adults and how it connects to any of the other interests you might have. So our next slide will give us a little definition. So what is geropsychology? It's probably a word you haven't heard before. Even most of my older clients haven't heard the word until I've told it to them. And geropsychology is a specialty within professional psychology that focuses on applying all the stuff we know about psychology theory and methods, specifically towards the goal of understanding and helping older adults and their families. So we take all the great stuff that we learn in clinical psychology broadly, and then we shine the flashlight on older adults. We take all that knowledge, theory, methods, clinical practice, expertise, and then we use all of that to benefit the lives of older adults and those who care for them and their family members. Okay, next slide, we'll talk a little bit about what do geropsychologists actually do. So you might just load that up so all the text shows up on there. You can do it all at once, thank you. So we provide individual therapy, couple and family therapy, and group therapy, just like other psychologists, but we do it with older adults. We also do psychological assessment, just like clinical psychologists in general do. So we're a niche within clinical psychology. And we, as people who do assessment, we have a particular expertise in doing general cognitive screenings, doing capacity assessments, for instance, determining if a person is capable of making their own medical decisions. That might be the kind of assessment that we would do as a geropsychologist. We are not neuropsychologists, although there's a good number of students who come through our program who specialize in both neuropsychology and geropsychology. So as geropsychologists, we're really clinicians. We do a lot of treatment, And many of us do some general cognitive screening. You know, how's someone doing? Kind of establishing a baseline at some point in their sort of young, older years, giving them some sort of basic neuropsych screening measures to get a general sense, but we're not the people that you go to get a diagnosis for dementia. To do that, you would become a neuropsychologist. And you might well, as a neuropsychologist, refer that person or their family to a geropsychologist to implement some of your treatment recommendations, to provide caregiver support, to do some education and things like that. So we are really very much on the clinical side of things, although we do some general assessment as well. We also work in a lot of varied settings. So we work in multidisciplinary healthcare settings a lot. We also do a fair amount of consultation and training within those settings. So for instance, skilled nursing facilities, assisted living facilities, they will hire clinical psychologists on a kind of per diem basis or have contracts with clinical psychologists in our small businesses that we run to come into the nursing home to provide healthcare services, mental health care services for their residents. So that might include therapy, group therapy, that might include some assessment, and that might include doing staff trainings as well, or other types of consultation for the staff. So again, we have a lot of different and varied roles that we can fulfill within organizations that serve older adults, as well as the more kind of clinical psychotherapeutic roles you might sort of already have in mind as you've shown up for today's training. Okay, let's move on to the next slide. And again, you can just load up all those bullets there. These are all the different types of settings that we might work in. There we go. As a geropsychologist, as I was saying, we often work in healthcare settings, primary care, long-term care. So that would be things like assisted living and skilled nursing facilities. We might work on palliative care units or hospice care units within larger healthcare systems or hospitals. We might do outpatient psychotherapy. So I personally have a small private practice outside of my time as a faculty member where I serve predominantly older adults on a fee-for-service basis in my small private practice. So that's the work that I do right now in sort of parallel to my role at William James. We can also work at geriatric inpatient units, psychiatric units, work in the Veterans Administration. They hire and train many geropsychologists there. And then also we can pursue academic and research roles and other entrepreneurial pursuits. Like I was saying, a lot of these skilled nursing facilities hire people as consultants, so or trainers. So you could kind of develop a niche specialty for yourself going into these facilities and offering trainings. And I have some colleagues who do that kind of work. So there's a lot of different opportunities. This is just kind of a broad-based sort of sense of all the different places that you might find a geropsychologist, or perhaps you should find a geropsychologist if there were enough of us. So let's move on to the next slide, and you can load up all those bullets. So we work with older adults across the range of identities and from across a range of backgrounds. And I'm not going to hit every single one of these here, but I do want to emphasize the sort of focus here at William James, which I think actually I have another slide later on that I'll talk more about this, but we really are thinking about serving older adults as they exist in our current world, across the range of identities, you know, all these different older populations, you know, so people from diverse backgrounds, older adults of color, older people from the LGBTQ population, older veterans, older people who are incarcerated. We've got some students who've worked in prison settings working with older adults in those places. So older adults are all over the place and come from all different backgrounds and have lived all different kinds of lives. So whatever it is that you might be interested in, if you've got other interests in psychology, you'll think about, or I'd encourage you to think about the ways in which those interests dovetail with older adults. So even if you're interested in working with children and families, you will find many communities with intergenerational homes or where grandparents have taken on, for various reasons, the majority of the parenting, the caregiving duties for young children. So even if you are largely interested in working with younger populations or families, grandparents are indeed part of families, and grandparents in some communities, as well as in various situations, find themselves doing quite a lot of child care. So what else can I highlight from this list here? Certainly, let's see. Well, I guess this would be a good time to mention that many people, when they think about working with older adults, they tend to think about working with older adults with cognitive issues. They tend to focus on the kind of neuro side of things. They tend to be thinking a lot about dementia. And certainly we do need a lot of people to do that work. But again, geropsychologists do so much more than that and serve so many more people than that. So I'd encourage you to really expand your thinking out beyond that. And similarly, many people sort of piece together working with older adults as sort of the same thing as working at end of life. And that's definitely not the case. If you wanted to specialize in doing end of life care, you certainly could, and being a geropsychologist and or a health psychologist would be a great set of tools to have in your toolbox. But geropsychology is not all about end of life. Remember that older adulthood spans from, depending on who you're talking to, age 60 or 65, all the way to the end of life, whatever that might be, could be over 100. So it's many decades of life, and by no stretch is it all or even mostly end of life work. So I hope you see on this list here some populations that maybe excite and interest you, and I'd love to hear more about what interests you, along with potentially working with older adults, if there's anything else that you think might dovetail nicely with that interest. Okay, let's see, next slide. We'll talk a little bit more now about us at William James. So let's, load that up. So what makes us unique? Well, we're very unique in terms of geropsychology training. First of all, there are not a lot of schools that offer any geropsychology training at all. You might have noticed when you look around at different schools, there'll be zero mention of geropsychology. You might find one course somewhere on the listings of something like aging and mental health. You might find one class about death and dying, something like that, as an elective. You might get a little bit of exposure to older adults. You might hear a little bit about aging during a lifespan development class. But most schools don't have people on the faculty or training sites that specialize in geropsychology. And so here we are at William James. We have clinically focused training. So we're one of these PsyD programs really focused on helping you to become a clinician, a professional psychologist, as opposed to a researcher, although I do some research and I love research, and I think that clinicians who do research are really, it's a wonderful bridge to build. But we're not an academic institution that has, lots of grant funding in a lab that will, teach you to do nothing but write journal articles for the rest of your life. If you want to write journal articles, that's fabulous. In fact, I'm working on one right now with one of my students. But we are predominantly clinician focused in terms of who we're training to go out in the world. So we are one of only 2 PsyD programs in the country, last I counted, with a geropsychology concentration. There are some other programs that offer geropsychology across the country. They tend to be more PhD programs that are more research oriented. And we're one of the first programs in the country to have geropsychology specialty training. This goes back to the 1990s when Erlene Rosowski joined the faculty and started to really build out and develop that. She's a real leader in the field, and recently retired and is very much still around and helping to mentor students. Another thing that makes us different at William James, I think, is our social justice mission and how that extends into our concentration. That's something I'm personally very passionate about, really focusing on intersectional aging and how we can serve older adults from a variety of backgrounds and lived experiences. So that's something that's very important to me. It's really it's sort of in the bones of our school, and something that I'm very passionate about within our Gero specialty program as well. Okay, we can move on to the next slide. So these are the two broad areas that I think of our geropsychology concentration as addressing. So the first one is, we want you to be a clinical psychologist who can become a specialist in geropsychology, who can get the board certification to become a future geropsychologist. So you will be over-prepared for the board certification requirements. So after you become a clinical psychologist, you can then apply for board certification. You have to demonstrate a certain amount of coursework, a certain amount of field experience with older adults, and then you can go through the board certification process to become a geropsychologist. So that is really the specialty track. And then the second option here is, as I was sort of alluding to earlier, is really training people who can be competent generalists. So if you are interested in serving adults of all ages, working with people across the lifespan, we want to make sure that you graduate from William James with the expertise you need to serve older adults generally, and also to know when to refer to a specialist geropsychologist. So those are really the two broad pathways or ways that I sort of think about our program here. And then also sort of connected to this, if you're thinking about other specialties at William James, maybe I should put a C on here because the other option would really be to marry geropsychology with another specialty. So for instance, you might be interested in health psychology and geropsychology together. The two are natural buddies. In fact, the Foundations of Health Psychology class is one of the optional classes in our concentration. As I said before, we have students who do neuropsychology and geropsychology. So when they're out there doing all their neuropsych assessments, they have a good sense of what goes on and what's available clinically to make really strong recommendations for older adults. And then we also have students interested in, for instance, our Asian mental health program and geropsychology. So we might graduate somebody who can go out and particularly serve older adults from an Asian population. We've had a few students do Latino mental health and geropsychology. Again, just thinking about some of those other niches that sort of cross paths with Gero. We have a number of students who've been interested in serving veterans and older adults. I've got a couple of them working closely with me right now. I trained in the VA myself, so I have a real soft spot for working with older veterans. So people might do the MVP specialty and the geropsychology program. So people do sort of pair up geropsychology with some of these other areas of interest for them, and I fully support that as well. Okay, let's move on to our next slide here. This is what happens after you were to graduate. So let's imagine you decide to come to William James, you decide to do this geropsychology program. What happens on the other end? Well, you can do a bunch of great things. You can provide psychotherapy, you can do those cognitive screenings that I mentioned, as well as other aging-related assessments. So you might still be trying to figure out what a diagnosis might be for someone. You might be doing a personality assessment, other types of assessment. You might really become a leader in healthcare and other practice settings. Again, there's such a need for people who have the expertise of serving older adults, so that when you show up at a job site and people know you have this expertise, certain duties will naturally come your way. So there's really opportunities there to step forward and be a leader, be a thought leader, be a person who can help guide policies within various types of healthcare settings, having the expertise that you have as a geropsychologist. You can build and evaluate programs that serve older adults. You can collaborate with other agencies that serve older adults. We have relationships with elder services, protective services. We also have some relationships with local nursing homes and other types of facilities. We also have some good relationships with the local councils on aging as well. You can also do supervision and training, train the next generation of geropsychologists. You can consult with other professionals. I've just recently got contacted from somebody who's starting a private practice and wants to build this expertise and has no training in it. So I'm going to do some consultation with her and help, build up that skill set so we can continue to do that kind of work into our profession, teaching other people, being an advocate for mental health and their needs. This time right now with COVID, there's so much going on in nursing homes and really a lot of mental health consequences to some of the policy decisions that have been made. And psychologists within these facilities, as well as geropsychologists across the country, have been doing a lot of advocacy work to try to make sure that older adults' mental health needs are met while we're also trying to do what we can to stop this pandemic. And of course, we can always be engaged in research from a small degree to a large degree based on our interests. All right, let's see, next slide, yeah. Okay, so as I was already saying, this idea of intersectional aging is something that's very important to me. Understanding where a person's position in the lifespan intersects with other aspects of their identity or social location that creates unique outcomes for people. So age and social class, age and gender, age and race or ethnicity, age and health status, gender identity or sexual orientation. These are all things that I'm thinking a lot about and that I really encourage our students to be thinking about and wondering about. So this is really something I'm passionate about and I try to build into our program as much as possible. Moving on to the next slide. Let's see, I already sort of got into this a bit, but these are just some of the possible connections between geropsychology and other areas you might be interested in. I already listed a few of these out, so I will not spend a lot of time on this slide, but as I was saying, there's so many places where geropsychology connects to other aspects of clinical psychology. So let's get down to the nitty-gritty here in the next couple slides. I realize that font is a little small, I apologize. So here we are looking at the next few slides go over some of the requirements for our program. So we have coursework requirements, we have field placement requirements, we have requirements regarding the doctoral project, and a couple other smaller requirements, as most of the concentrations at our school have. So first, the coursework. Right now, we have a program that is, if you were to do what's called a major area of study, sometimes people colloquially call that the concentration. That is 8 credits, and that is a mix of 2 required courses, which is our geropsychology class and our special topics in clinical geropsychology. So the first one is a prerequisite for the second. So that pair of classes really gives you much more knowledge about working with older adults than pretty much anybody else in the field right now. I mean, it's, again, aside from a few of these other programs that that have any kind of specialty training, most schools don't have anything close to this. So just by taking those 2 classes, you'll be so much further ahead. And then you have a pair, you can use your other 4 credits in the major area there and pick amongst a handful of other possible courses. You could do the neuropsych of aging class, you could do end-of-life interventions. We have a course that's offered in partnership with Harvard Medical School where you learn about healthcare policy as it relates to aging. We have a psychopharm class, and as I mentioned, you could also do the health psychology class. And then if you're going to do the emphasis, so you're interested but maybe not quite you don't quite want to go as far as doing the major area of study, then that requirement is 4 credits, and that's our general geropsychology course, and then one of the list of recommended electives that you see there. So it's just a matter of number of credits and which courses are required. So let's see, let's go on to the next slide. Whoops, there's your coursework. Maybe if you click that one more time, you'll see the heading on that. There we go. Okay, field placement. Within the concentration, that major area of study, we want to have you spend 1 whole year really focusing on working with older adults in a practice setting. So that would be, you know, as I was saying, we've got relationships with some local nursing homes, some elder services sites, a variety of places that you might train, including in the VA, to get a whole year focused on geropsychology. And then we also hope that you'll have another opportunity to do a placement with doing substantial work with older adults, but also serving other populations as well. And then we really encourage people to do an APA internship using the national match at the end of your training. There's lots of really fabulous geropsychology training sites nationally, and including some in the New England area that we think are really just wonderful and really help you to continue to develop that special identity as a geropsychology specialist. So at the moment, we don't have a geropsychology focused site within the consortium at William James, but we do have a few irons in the fire under development. So that may become an option down the line. Then if you were to do the emphasis, then we wouldn't need you to spend a whole year working only with older adults, but we do want to make sure you have at least 1 placement where you're doing a substantial amount of work with older adults. So that's field placement. And then the next slide is the doctoral project. It's basically a matter of degree of focus here. So if you were doing the major area of study, we really want your doctoral project to be focused on geropsychology, to sort of be solidly within that specialty niche, to have a topic really focused on aging in some way. Whereas if you were doing the emphasis, the project just has to have some kind of relevance to older adults. It doesn't necessarily have to include older adults in the population you're studying. It might just be that the topic is relevant to older adults in some broad way. So for example, I had a client, and I'm sorry, not a client. I was talking to somebody earlier about some clinical work. I have a student right now who is thinking about doing a project on this topic of toxic masculinity. And she came to me wondering, like, I'm not sure, I want to do the concentration, but maybe the emphasis, I don't know if my topic is relevant at all. And I said, of course it's relevant. It's 100% relevant. So this idea of toxic masculinity definitely affects the lives of a lot of older men right now. So that would be solidly a topic in the emphasis area. And then if she were to actually sort of zero in even further and have some older adults in her study, well, then we're talking about a project that would be solidly in the domain of geropsychology. So that's just one example of a doctoral project topic that could be kind of seen or spun in different ways. Okay, let's move on to our next slide. I just have a few other kind of small requirements. We have at the school a student group called the Gero Volunteer Corps. It's very informal. It's meant to be a mix of socialization with other students as well as doing some service work for older adults in the community. So we ask that you be a member of that and be involved to whatever degree you can. We don't enforce a certain number of hours of being involved in the GVC, but we do ask that you sort of become part of the crew and participate to whatever extent you're able to. We also ask you to attend some continuing education programs relevant to the topic of geropsychology and some colloquia for for students as projects that are focused on the topic of geropsychology as well. So there's just a few other things that you see there. And I think that's it for that. Let's move on to our next slide. Move away from academics a little bit. I'll say a little bit more on geropsychology and some of the other stuff that we've been up to in our program. So we have the oh, maybe if you hit that one more time, you'll see the heading there. Yeah, sorry about that. I don't know why those are showing up last. So the GVC, as I was mentioning. So this is a student-led, student life organization. We work with older adults directly within the community. Sometimes we have partnerships where older adults will come to the campus or will go to them at community centers, skilled nursing or assisted living facilities. And make connections and do things, not non-clinical work, but various types of service projects. Some recent activities have included leading a music and reminiscence program at a couple of assisted living facilities in the area. So students showed up, played some music, had people talk about what kind of memories the music brings up for them. And again, very sort of non-clinical social opportunity to provide some engagement and stimulation for these older adults. There was a program about prevention of fraud that is in the process of being developed that would be provided at Councils on Aging as an educational module, so students could lead that. Also, every year we do the Walk to End Alzheimer's Disease every September. What else have we been doing recently? We've been doing a monthly, we're calling it Coping and Connecting. It's a 1 hour long seminar slash social activity time. It's on Zoom. We started it after the pandemic for the Council on Aging up in Chelmsford. And we've been just covering a bunch of different topics. For November, we're doing a topic on attitude of gratitude. And we did something on creativity one month. We talked about, let's see, what was that? We're talking about reminiscence and life review another month, you know, sort of writing and sharing your personal stories. So just a variety of kind of wellness and positive psychology sort of related topics. We just did one on sleep recently as well, taught a lot about sleep hygiene. So kind of provide some psychoeducation, some opportunity for support. So that's been a great and fun activity for us to do with the GVC. Also, this is really an open group. So it's really students show up and come up with ideas. And then, you know, as a faculty member, I'm the advisor. I just try to help make them happen. So we've got some pictures on the next page here. You can go to the next slide. Yeah. So we've got some baking that we did for Thanksgiving last year. We made, gosh, hundreds of desserts that were delivered to homebound older adults who were getting Meals on Wheels and home delivered Thanksgiving meals. There's a pic of us from the Walk to End Alzheimer's, and there's some oh yeah, that's right. There was also another program that was a little while ago where we actually taught some computer skills to older adults as well. So you can see that in there too. So that's just a few things that we've been doing in the GVC. Let's move on to the next slide. And maybe hit once more there for the heading. So two other sort of broad areas of activity within sort of the broader William James community related to geropsychology. One of those is the Alliance for Aging. So this is connected to our Office of Community Engagement. I just took the helm of this program this September, so it's in a transition time, and I'm looking forward to building it out and seeing what it can become in the years ahead. But basically, we are building bridges between William James and local organizations that serve older adults to try to bring this expertise, this sort of specialty niche set of skills that we have as geropsychologists, and help them kind of infuse the organizations that serve older adults in the greater Boston kind of area. So we've got that in development there. And then also in research, myself, as well as Dr. Rosowski, who I mentioned just retired, but is still around and providing some mentorship and still very much professionally engaged. We both always have some kind of research, something going on in the pipeline. So if people are interested in doing that along the way, we would absolutely welcome people's engagement. And you can move on to the next slide, which is a little bit, we've got a few slides here of just some cool stuff we've been doing. So this is a presentation we did last year. In the middle there is one of our students, myself on the far right, Arlene on the far left there at the top. Led a symposium all about helping to to turn the tide. You know, I'm using lots of wave metaphors when I'm thinking about geropsychology. So really interested in this workforce development issue and how do we help train and recruit future geropsychologists. And we shared a nice presentation as part of that symposium about our GVC. And we can move on to the next slide. Got a book chapter that's coming out sometime in the next year that I co-authored with one of our students who's now at her internship. And then we did a poster that was at APA, virtual APA over the summer from a survey that we did of William James students about working with older adults. And then the next slide here is another presentation that we're doing next week. Yeah, that's next week at the Gerontological Society of America. I've got several students helping me out on that project as well. So I'm pretty active. I enjoy doing this work and I really love mentoring students and getting them excited about research. But again, always kind of within that frame of primarily training future clinicians. And then one more slide here. We have student who is interested in doing more advocacy. So we participated in the American Psychological Association's Stand for Science campaign, where we met with our local Joe Kennedy Jr., our local legislator, and advocated for the cause of bringing more evidence-based psychological research into policy making. Moving on to the next slide. A little bit about some of what our graduates do. We've got graduates out there in private practices, like the one I mentioned that I have, doing psychotherapy, doing assessment, full-time, part-time, whatever you want to do. So running our own businesses, being entrepreneurial. We also have folks who join group practices and very much in demand, people having competence and interest serving older adults within group practices, or working possibly within skilled nursing facilities. We have an alum who's at one of the very large and well-established continuum of care communities in the Boston area. She got the job pretty much right after finishing her training because the need is there and she was able to roll right into that job. We've also got our graduates within the Veterans Administration serving older adults in a variety of different roles there. We've also got our graduates training and supervising students out there in the field. Moving on to the next slide. So I'm looking forward to taking any questions that you might have. This is more or less my last slide with any content here. I really just want to encourage you to apply. And I want you to know that we really are welcoming of applicants from non-traditional academic backgrounds, people coming from, whether you're coming directly from your undergraduate program or you're coming from a graduate program, or you've been out working in the world for a while. So we welcome career changers, people who are coming to grad school, you know, from a work setting. I took time off between my undergrad and my graduate. My undergraduate degree was not in psychology, so it was a career change of sorts for me. So I really embrace and welcome that for when I'm looking at applicants for our program. I'm also really serious about helping to improve representation in the field of psychology broadly and geropsychology in particular. So I would love to talk to anybody and welcome applicants from all sorts of backgrounds. If you're passionate about serving older adults or particularly underserved older adult populations, then I would absolutely love to hear from you. And we do have the Green Mountain Scholarship, which will be granted to one potential person in next year. So incoming, the person would be incoming in 2021. So we've got one scholarship for that year and hopefully more to come, but I can't say for sure. So that's it. I think that's my last slide. My last one just has my email address on there. Please feel free to be in touch with me if you have any questions about our program. I would love to hear from you and help you decide if it's the right place.
Fantastic, Dr. King. Thank you for that wonderful presentation. Hi, everyone. My name is Elizabeth, and I am an admissions counselor here at the college. And while we are on the slide for interested in applying, I thought that I would say a few words about how you would apply to the clinical psychology PsyD program at William James College, and then, you know, later on, either to have the major area of study or an emphasis, or become a generalist who has some more training in geropsychology. So We are currently accepting applications for fall 2021 enrollment, and there are deadlines coming up in December and in January. There is an early consideration deadline on December 9th. And in order to apply to the program, you would begin an application online through our website, williamjames.edu, and you would fill out the online application and then provide us with a series of materials that include the online application, your CV or resume, an application essay, 3 letters of recommendation, the GRE, and official transcripts from all colleges or universities that you've attended. Again, all of this information is posted to the website, so you can go there for more information about the program and, again, the admissions process. And I would also like to extend to you an offer to connect by email or by phone. Contact information will be at the end of the presentation, and again, you can access that through either the handouts or you can take note of it once it's on the screen in a couple slides.
Great. Thank you, Elizabeth, and thank you, Dr. King, for this amazing webinar today. There's so much information shared. So as Elizabeth just mentioned, I'll just mention again that you can go to the handout section to download all of these slides. So there is so much covered that I definitely recommend everyone take a moment to do that. So we can move on to the next slide, which I think shows that we're at our Q&A portion. So this is your opportunity to enter any questions you have, anything you would like to ask of Dr. King, of Elizabeth, about anything you've heard today, anything you need clarification on, or would just like some more information. So definitely submit any questions you have. We have a few minutes left to go through those. So Dr. King, could you elaborate a little on what's unique about working with older adults, maybe some misconceptions that people might have before working with older adult populations?
Absolutely, that's great. So that feels a little bit like there's 2 questions in there. So the first one, what's unique about working with older adults? Well, one thing that I think it's a matter of degree rather than that there's things that are completely 100% different. So for instance, we would train and do train all of our students to understand what's going on with our clients medically, right? We want to make sure that we are helping people get appropriate medical rule-outs of any symptoms they might be showing up with. Even if someone's like, for instance, showing up with depression and they're very tired all the time. Well, let's see, do you have a sleep disorder? You know, so something like that. We, of course, want all psychologists to be able to do that in a competent way, but the expertise, the level of expertise that's needed to serve older adults, particularly older adults, you know, so one thing that you want to think about when working with older adults is that there's several cohorts of older adults that, you know, you might think of sometimes in geropsychology, we talk about the young old and the oldest old, you know, so it's very different qualitatively being 65 versus 95. So as people get older and become more medically compromised, we need to have the expertise to make sure that we're being very thorough in helping a person get the rule outs that they need for any type of symptoms that might be showing up with. We have to really understand cognition very well so that we know what is normal aging in a person's brain versus what could be the onset of some kind of dementia. So we need to understand that very well. We also really have to understand the historical context in which our clients grew up. So the way that I like to think and teach about this is that when we're working across generations, we are working across cultures. So when you are treating somebody who grew up in the 1930s or 40s, it's very different than treating somebody who grew up and came of age during the 1980s or the 1990s or the 2000s. So we really need to understand historical context and the influence that those much earlier life experiences had on those person's early development and how they might be influencing them now. So again, that's generally true. I would hope people would be thinking about that whenever there's an age difference between the clinician and the client, but particularly when that age gap gets broader and broader, we're talking about people who are older and older So those are a few things that come to mind. There's certainly more. I could go on and on, but I want to make sure we have room for other questions. So that was some of what's unique. The next is potential misgivings, I think, or misunderstandings. Well, yeah, I've actually done a fair amount of thinking on that. And it seems like one issue is that a lot of people are afraid that they are too young to help older adults. They think that older adults may not want to be helped by a clinician who's in their 20s or in their 30s. And that is just not true. When people are in need of help and support for their mental health, what they want is somebody with appropriate expertise, you know? So they want somebody who has good training, you know, they want someone who has the expertise needed. So as a psychologist, as a trained and licensed professional, you have that expertise and you can feel confident that you have something to offer this person, even if your life experience has been very different from them. So while there will be occasional clients who don't want to be helped by somebody who's much younger, my experience has been that I have been fired from treatment more often for other reasons than because of my age. So for instance, I have had people who decide they don't want to work with me because I'm not a parent, or people who want somebody for substance use treatment who's in recovery themselves and I'm not. So people have a right to have preferences for their clinicians, and occasionally there'll be somebody who decides they want to work with an older clinician. But I have had no problem filling my practice, and that's the same thing that I've observed from other early career geropsychologists as well. But that does seem to be a misunderstanding. And then I sort of alluded to in my presentation, some of the other misunderstandings is that working with older adults means working with death, or it means working with dementia. And it just absolutely does not. You could have a whole niche practice helping people navigate through the journey of retirement, you know, from the few years before retirement to the few years after retirement. You could do a whole career serving older couples, you know, just providing couples therapy to older adults. There's just nowhere near enough people who have that expertise. So those are some of the misunderstandings or misgivings, I think, that I've heard, just to name a few.
Okay, great. You mentioned in your presentation that you have some students who have a concentration in geropsychology, but are also involved in other concentrations across the college. Could you talk a little bit about how that works with like managing course load and juggling maybe for the doctoral project with the different emphasis?
Yeah, absolutely. It's very doable. The geropsychology concentration fits next to all of the other concentrations. And if there's ever any kind of problem for whatever reason, I am in the position of authority to help to make sure that we can make it work for you if you come in with that interest. Basically, what it means pragmatically is that if you're choosing more than one concentration, or you're doing one concentration and one emphasis, that basically all of your electives are going to be taken up by doing those two things. So that's really what it comes down to, is that any of these concentrations or emphasis areas use your elective credits, and you only have so many of those. So when you choose more than one, again, at least as far as I can determine, geropsychology fits next to all of them without going over your max electives. It may be that other pairings that doesn't work, but with Gero, we've really worked hard to make sure you can at least do the emphasis next to any of the other concentrations. Was that the question? Was there another piece to that?
Yeah, just if there was a particular influence on the doc project, if you have more than one concentration.
Oh, yeah, right. Well, if you choose to do two concentrations or a concentration and an emphasis, then you're going to pick a topic that, you know, is at the intersection of those two. And usually that's something people are really excited about, because they're really excited about both concentrations. So you might, for instance, I'm thinking of a student I'm working with now who's doing neuropsychology and geropsychology, and you know, he's got some data he's got from field education, one of the field sites he's at, a bunch of neuropsych data from older adults testing results. And so he's going to be doing some analysis of that. So that checks the box for both. You know, the student who's interested in Asian mental health and geropsychology will do a project that is a bridge between those two things, right? We'll look at older Asian individuals on some, you know, with some on some specific topic within that population. So it's very easy. Also, thinking some other students, I've got a student who's doing the military and veterans program as well as the Gero program, and her topic is looking at moral injury in older veterans. So again, moral injury is kind of a general topic. Older veterans is the population, very easy way to hit the sort of check both boxes there. So yeah, it's health psychology and Gero is another pairing that has gone through and is very easy. As long as you either have older adults talked about in your literature review, older adults as part of the sample that you're studying, you'll be good for the checking the box for the Gero concentration or emphasis.
Okay, great. We have a question here asking how many students generally declare a concentration or emphasis in geropsychology and how big the classes tend to be.
Got it, yeah. Since I'm just taking on the role of concentration director, I don't have all the numbers historically, so I couldn't give you like a 5-year average. But I would say the concentration tends to have less than 10 people in it. I think right now we have 5 or 6. And that's a little bit, people can enroll pretty much any time in the program. So sometimes people don't formally enroll until later in the program. So then the number gets a little bit harder to determine. But yeah, I'd say less than 10, and the classes tend to be small. My Gero class this semester has 8 students in it. The intro Gero class last spring had, I think, 18 or 20. The intro Gero class anyone can take, so that was a mix of geropsychology students as well as students who were using it as an elective, who were training to be more generalists. So they don't tend to get much bigger than that, and they tend to be on the smaller side of the classes. The end of life interventions class has run as a directed study with 4 students in it, so that one tends to be on the small side, a very intimate experience. Yeah.
Okay, could you give a few more examples of some of the different field placement sites that some of the students, maybe recent students, have been at?
Sure, yeah. So let's see, I'll just kind of mentally go through my list here. So we have students at Bedford, VA in their geropsychology sort of training track, which involves a rotation doing palliative care, a rotation doing long-term care, and then also at Bedford, VA, there's an outpatient track where they can get older adults to serve, even though they might see a few other younger folks. So that's like a substantially Gero experience potentially. We have students at, or we have the possibility for students to train at pretty much all of the Elder Protective Services sites in Greater Boston. So the Cambridge Somerville Elder Services of the Merrimack Valley, Ethos, which serves Southwest Boston, like Jamaica Plain and Roslindale, and so on. So there's several Elder Services Protective Services sites. We have site 2 Life Communities, it's called. It's a skilled nursing, continuum of care, assisted living kind of place. We have periodically, on and off, had students at Hebrew Senior Life, which is a large continuum of care facility. So we're hoping to have students there. There was a transition of staffing there, so we had a lot of people there, and then they didn't have a psychologist to do supervision for a year or 2, but we're hoping to get that one launched again soon. And let's see, what are some of the other folks? There is PACE programs. I don't know if people are familiar to those, but they're programs that serve older adults in a kind of day program sort of model. So we've had folks training at sites like that. And those are the ones that tend to be really Gero focused. There are some other sites, again, sort of people working in group practices and training in sort of generalist type settings where people can carve out a certain percentage of their caseload serving older adults. So I do have a handout that has a listing of all the field placement sites. So I'd be happy to share that with anyone if they want to email it to me or send me an email. I can email it back.
Okay, thank you. We're coming up on our time, so we can move to the next slide. And as Dr. King just mentioned, feel free to reach out to her if you'd like any more information about anything that we've talked about today. or have further questions that you didn't get a chance to ask during the webinar today. So again, you can download this slide along with all the other slides in the handout section. There's a PDF there, so you can have this contact information to go back to. Or you can visit williamjames.edu and you can find this same information along with you know, different stories about some work faculty are doing, student achievements, different events that the Dean of Students Office is holding. There's a lot of great information, not only about, you know, academics and admissions, but about all of the great things that are happening at the college. And lastly, I'll say that you can connect with us on any of the social media sites listed there. It's a great way to see really a lot about the William James College experience and what it's like to be part of the community. So I definitely encourage, if you're on any of those platforms, to look up our profiles. So thank you everyone for attending the webinar today. And thank you again to Dr. King and Elizabeth for your presentations. So I hope everyone has a great rest of your afternoon.
Thank you.